Hi class, in this recording we're talking about senescence, loss of function of the urinary system, and some homeostatic or disease imbalances or disease states of the urinary system. As we age, we have renal atrophy. Our kidneys become smaller, 1/5 to 2/5 smaller by the time we're 90 years old compared to when we were 30 years old. We lose nephrons, and the remaining glomeruli that we do have, the capillary beds within those nephrons are going to be atherosclerotic, so they don't work as well, and the overall filtration rate goes down. This means that we have a very difficult time clearing drugs as rapidly. You may have talked to individuals about how when they were in their early 20s, they could party hardy on Saturday night, wake up Sunday morning, need a little recovery time, but by Sunday afternoon, they were totally fine. But when they got to be 30 or 40 years old, all of a sudden, if they were party hardy, they needed 2 or 3 recovery days. And it's the renal atrophy that helps to explain why it takes longer to recover from those binge drinking scenarios as we age. We also have a harder time regulating fluid balance. As we have renal atrophy, we also become less responsive to the hormones that act on the kidneys, like antidiuretic hormone. And our sense of thirst is going to be sharply reduced. We have reduced thirst as we age. We also have a harder time holding onto fluids as we age, which makes it much more likely that we become dehydrated as we age. Another thing we struggle with is voiding and bladder control. For men, 80% of men over the age of 80 have benign prostate hyperplasia, which is to say that nearly every man over the age of 80 has an enlarged prostate. And that enlarged prostate is going to pinch off on the prostatic urethra, making it to be more difficult to void urine. It's also, and as those males retain urine longer than they should, keeping that extra urine in the urinary bladder for an extended amount of time is going to only aggravate and accelerate the failure of the remaining nephrons those individuals have. On the female end of the spectrum, females are oftentimes going to be incontinent as they age because of weakening of the urethral sphincters. This weakening of the urethral sphincters is accelerated by vaginal childbirth. If somebody has an infection of the urinary bladder, typically bacterial infection, that's referred to as cystitis. This is very common in females because they have a short urethra. Cystitis is frequently going to be triggered by vaginal intercourse. So it's not going to be oral sex or anal sex, but vaginal sex, where there's vaginal penetration. This is one of the reasons why a lot of females have a micturition reflex after they have vaginal intercourse. And many women report that after they have vaginal intercourse, they have this strong compulsion to go and urinate. And this strong compulsion to urinate after having vaginal intercourse helps to reduce the rates of having a urinary tract infection, because it's much more difficult for the bacteria to go upstream through the urethra if the woman's actively urinating immediately after she had a bunch of bacteria pushed up into her urethra. If somebody has that infection spread all the way up into the renal pelvis, it's called pyelitis. And if that infection continues to spread all the way up into the nephrons, it's called pyelonephritis. And pyelonephritis typically is going to result from blood-borne bacteria. It's very difficult for blood to travel, or bacteria to travel that far upstream through the urinary tract, but occasionally it can happen. We also have kidney stones all throughout our lifetimes. A kidney stone is technically known as a renal calculus, and it's going to be some kind of mineral that's precipitated out of the urine. These common minerals that precipitate out of urine include calcium phosphate, calcium oxalate, uric acid, and a magnesium salt known as struvite. And depending on what the mineral is, the kidney stone can have a different appearance. Uric acid kidney stones, for me in particular, are the most horrifying ones, because those are the kidney stones that have the jagged crystalline edges to them. Oh, these are usually going to be so small that they just go right through our urinary system. We don't know that they happen. Things that increase the risk factor of kidney stone formation include consuming way too many dairy products. So you have too much calcium in your urine, or you don't drink enough water so your urine is extra concentrated for a long period of time. If somebody is passing a large jagged stone, so a big uric acid-based stone, that's excruciatingly painful. I've had 3 students over the last decade who are parents. They are non-traditional students, and they've given birth naturally without any anesthesia, and they've also passed a kidney stone. And 3 for 3 have promised me, they guaranteed me under no uncertain terms, that passing a kidney stone is much more painful than giving birth without anesthesia, according to their opinion. And I'll trust their opinion on that one. I'm a guy. What do I know about giving birth? Or at least how it feels. Oh, went a little farther. Let's back up. Any discussion of kidney stones would be remiss if we did not mention the Staghorn calculus, the most DBGB-inducing kidney stone out there. If somebody has way too much calcium in their blood, if they're dehydrated, if they have a pH imbalance, and they have an enlarged prostate, which means they don't urinate frequently, they can have a really, really big kidney stone built up. So big that it fills up the renal pelvis, the minor calyces, and the major calyces and part of the minor calyces, and extends up into the kidney and looks like the antlers of a deer. Hence the name Staghorn, because it resembles the antlers of a stag or a deer. To treat a Staghorn calculus, you typically are going to have to remove the entire kidney. At that point, there is kidney failure. If it is a small kidney stone, you could have kidney stone dissolving drugs that may be able to remove the kidney stone. You can pulverize the stone with an ultrasound. That's called lithotripsy. Or you can have the surgical method. And Staghorn calculi can only be removed with that surgical technique. If you have any questions or comments about senescence of the urinary system, please don't hesitate to post them on the class discussion boards or to shoot me an email. And as always, happy studies.